Welcome back. In today's video, we are going to discuss about chronic suppurative otitis media as a continuation of our ENT series. Chronic suppurative otitis media is a long-standing infection of the middle ear cleft. So in chronic suppurative otitis media, what is affected? The middle ear cleft, and the infection is a long-standing one. It is characterized by ear discharge and a permanent perforation of the tympanic membrane. So guys, here what's happening, because of a long standing infection, there is purulent ear discharge, and along with the ear discharge there is a perforation of the tympanic membrane, which is of a permanent type. The perforation's edges are covered by squamous epithelium. It does not heal spontaneously and becomes a sort of a epithelium-lined fistulous tract. So guys, here they are saying that this is the tympanic membrane. There is permanent perforation, a hole formation, and there is perforation of the tympanic membrane. And this perforation is not going to heal on itself. It will form a fistulous tract. Okay, fistula is nothing but an abnormal tract being formed here, and it is lined by epithelium. Before understanding chronic suppurative otitis media, you need to know the normal anatomy. I have discussed about it in detail in the previous video. Here we are going to brush up real fast. Here in the ear, outer ear, there is helix, tragus and lobule, which is continuing as an external auditory canal. This completes the external ear. And then in the middle ear, what do we have? We have the tympanic membrane where the permanent perforation is taking place. Auditory ossicles, that is incus malleus and stapes, which is continuing further as eustachian tube, which will be connected into the nasopharynx. Now we come to the inner ear. There is a round oval shaped cochlea, then oval window, round window, the nerve vestibulocochlear nerve. There is vestibular apparatus, which is containing the semicircular canals and vestibule. Okay. So we'll be focusing more on the middle ear. So you know in the ear where the middle ear is. The middle ear cleft. In the middle ear cleft, you have to remember the attic, which is a constriction, and then antrum, which is communicating posterior-inferiorly with the mastoid air cells. Then the eustachian tube, you know from this picture, how it is continuing. So you have to remember the antrum and the mastoid air cells, and empty space, antrum, okay, additus and attic. A normal human right tympanic membrane, okay, this is a tympanic membrane of the right ear, which is in a normal human. And now you see in a chronic suppurative otitis media, what is it doing to the tympanic membrane? It is causing a rupture and it is leading to hearing loss. You can see the perforation here, okay. Epidemiology. Incidence of chronic suppurative otitis media, it is more in the poor socio-economic standards and in the poor nutrition and lack of health education. It will affect both the sexes and all the age groups. Both male and females are affected, and all age groups, that is children, adults and even the old people are affected. In India, the prevalence rate is higher in the rural areas. In the rural areas, it is 46 people out of 1,000 people will be suffering with suppurative otitis media of chronic type. And it is lesser in the urban areas because they have good nutrition, health education is good, hygiene is good, there is no good socio-economic status. So the prevalence is less in the urban areas, that is 16 out of the 1,000 people. It is a leading cause of hearing impairment in the rural population. So from this picture we know, because of the perforation of the tympanic membrane, which is supposed to be like this, it gets perforated and it is causing hearing loss in the population. We have to discuss about the types now. There are two types of chronic suppurative otitis media: Tubo-tympanic and Attico-antral. Tubo-tympanic chronic suppurative otitis media. Now this is a normal tympanic membrane. What's happening in the tubo-tympanic type? It is a safe or benign Okay, this tubo-tympanic type is safe type compared to the other one. It is safe and it is a benign condition. Benign in the sense what? It is localized. It is not like metastasizing to the other tissues. There is no transfer or invasion into the other tissues. Just a benign localized condition. This type of chronic suppurative otitis media will involve the anterior-inferior part of the middle ear cleft, and it is associated with the permanent central perforation. So guys, here they are talking about the anterior-inferior perforation. This is the middle ear cleft. Now you see the anterior-inferior perforation and the large central perforation. In the tubo-tympanic type, what's happening? Anterior-inferior perforation and large central perforation. You can see in the picture, large central perforation. Okay, this is the anterior-inferior perforation. Okay, this picture, you can relate the same picture with this handle of malleus and the anterior-inferior perforation. As there is no risk of serious complication, it is a safe or a benign chronic suppurative otitis media. So guys, this is clear. There is perforation, permanent central perforation, and it is involving the anterior-inferior part of the middle ear cleft. The next stage, it is active or wet perforation. In this, the presence of inflammation of the mucosa and mucopurulent discharge can be seen. Hence, the disease is active. Why is it active? Because the inflammation is present and the mucopurulent discharge is seen. So guys, in the wet, or why is it wet? Because there is discharge and the discharge is mucopurulent. Inflammatory process has started. So you can see the picture here. There is inflammation and mucopurulent discharge. Hence, the disease is called active. Now, when it is inactive or dry perforation, there is absence of inflammation. It is dry. It is because there is no inflammation of mucosa and the mucopurulent discharge is absent. No inflammation, no mucopurulent discharge in the inactive type. Active, there is inflammation and there is discharge. Permanent perforation, the long duration of a non-healing dry perforation. We saw this dry perforation, but if it is non-healing, this perforation is not healing spontaneously. If there is a long duration of a non-healing dry perforation, it indicates that external squamous epithelium is fused with the internal mucosa at the margins of perforation. So guys, you have to understand what they are saying here. The external squamous epithelium. Okay, this is the lining. This is the external squamous epithelium. This is also the external squamous epithelium, and this is the internal mucosa. But this is fusing inside with the internal mucosa. I'll show it in red. This is fusing with the internal mucosa. This is also squamous epithelium is going and fusing with the internal mucosa at the margins of the perforation. Okay, so it is leading to a kind of perforation. So you can see here the squamous epithelium going inside and it is fusing with the mucosa. This is the permanent type of perforation. Healed chronic otitis media. Healing of the perforation will lead to its closure with the thin membrane. So how is the closure taking place? Starting with the thin fibrous thin membrane, but the rich fibrous layer is absent. It may be associated with tympanosclerosis or some conductive hearing loss. Okay, first thing what they are saying, there is some thin membrane which is not fibrous, but it is associated with tympanosclerosis or sometimes with the hearing loss. So what is tympanosclerosis? It is nothing but a medical term which is used for the scarring of your eardrum. If the tympanic membrane is scarred, then it is known as tympanosclerosis. In healed type, what's happening? A fibrous layer, thin layer will be there, which is not fibrous, a thin membrane will be formed, and sometimes this is associated with tympanosclerosis and conductive hearing loss. Now we move on to the next type, which is Attico-antral type. Attico-antral type, it is an unsafe, dangerous, posterior superior lesion or cholesteatoma. This type of chronic suppurative otitis media will involve the attic and also the posterior superior region of the middle ear cleft. So guys, we saw that in the anterior inferior type. Now this is in the posterior superior type. Okay, here the involvement is. What's happening here in atticonal? It is involving the attic, which we saw there will be. So we had seen in the middle ear cleft the Attico-antral, and which is joining into the mastodoid air cells. So this part attic and the posterior superior region of the middle ear cleft will be involved. It is associated with attic or the marginal perforation in the posterior superior quadrant of the pars tensa. So what we saw, the same thing. This is the pars tensa. In the posterior superior part of the pars tensa, there will be Attico-antral type. As it is often associated with the risk of serious complications, it is because of the bone erosion nature of the cholesteatoma, it is called as unsafe or dangerous. So what is a cholesteatoma? A cholesteatoma is nothing but an abnormal non-cancerous growth. Okay, it is formed behind the tympanic membrane. It is just like a cyst which will contain the skin cells or the connective tissue. You can see in the picture here the cholesteatoma. Because of this formation of cholesteatoma, which has the nature of bone erosion, hence it is unsafe or dangerous. Granulations and osteitis are present in many cases. Now they are talking about granulation. Granulation is nothing but now it is in the form during the healing process, a lumpy pink tissue will be formed with the new capillaries, connective tissues. Then it is known as around the wound that granulation tissue will be present. Okay. So we read the Attico-antral type, which is involving the posterior superior part of the pars tensa, and then there will be cholesteatoma formation. Because of this, it is unsafe. Cholesteatoma, we know this mass, okay, non-cancerous growth. Inactive self-cleaning retraction pocket in the posterior superior pars tensa or the attic region with the potential chances of cholesteatoma is called as inactive disease. So guys, in this what's happening, a retraction pocket, you can see the retraction pocket being formed here. This retraction pocket is formed in the posterior superior pars tensa. We saw the posterior superior, this part, posterior superior pars tensa or the attic region. There is potential chances of cholesteatoma. This can result in the formation of cholesteatoma. Cholesteatoma is a non-cancerous growth. Okay, this is the inactive form of a disease. In inactive, there is only the self-cleaning retraction pocket being formed. In the active, what happens? The cholesteatoma form is already formed. Now it is starting to erode the bone, forming the granulations, and they are present with putrid continuous ear discharge. In the inactive, there were chances of cholesteatoma formation, but in active, cholesteatoma formation has occurred. It is causing the bone erosion, and there is formation of granulation tissue, and there is putrid continuous ear discharge. So we have read about the two types. Let us compare both of them now. Tubo-tympanic and Attico-antral chronic suppurative otitis media. The nature tubo-tympanic, safe and benign. Attico-antral is unsafe and it is very dangerous. The ear discharge. Attico-antral, the order, it is absent, orderless. Tubo-tympanic, it is orderless. Attico-antral, it is malodorous. The amount is profuse and here it is scanty. The type tubo-tympanic we saw, it is usually mucoid, whereas in Attico-antral it is purulent, pus forming. Here it is mucus, here it is pus. Periodicity, it is usually intermittent. The discharge is flowing intermittently. Whereas in Attico-antral, it is safe and dangerous, the flow is going to be continuous. Then we move on to the perforation. We saw that the tubo-tympanic type, there is a central large perforation. In Attico-antral, it is in the attic or marginal. Granulations are uncommon. In Attico-antral, granulations will be formed. Polyp is pale, whereas in Attico-antral, there is a red and fleshy polyp. Cholesteatoma is absent. Here it is present, causing the bone erosion. Intracranial complications can never happen in tubo-tympanic type, whereas in Attico-antral it is also not uncommon. Okay, not uncommon means it might be present, it is quite common. Microbiology. The incriminating microorganisms are identical in both the types of chronic suppurative otitis media. In both tubo-tympanic and Attico-antral, both the chronic suppurative otitis media have identical microorganisms. Those are aerobic organisms and anaerobes. The aerobic organisms, most common one is Pseudomonas aeruginosa, Proteus, Escherichia coli and Staphylococcus aureus. Anaerobes, Bacteroid fragilis, which is the most common. In anaerobic, Bacteroides fragilis is the most common. In aerobic, Pseudomonas aeruginosa is the most common one. And anaerobic streptococci. So guys, in this to memorize, we have Pseudomonas aeruginosa, which is the most common, Staphylococci, E. coli, Proteus. Then in the anaerobes we have Bacteroides fragilis and Streptococci. Anaerobe, so you have to write anaerobic streptococci. Thank you. With this we come to an end of part 1 of chronic suppurative otitis media. We'll be continuing in detail about the other types of chronic suppurative otitis media in the next videos. Hope it is clear. If you like my video, hit the like button and subscribe.